This is Dr. Bidmos with Public Health Talks. So on today's show, I have Ms. Suaad Faruq Onikijipa with me today. And although she has an extensive bio, but this is a brief introduction of her. So she is a youth partner for Wellbeing for Women Foundation. She is passionate about mental health, which is something what we are really big on here at Public Health Talks. And women's rights, self-love, and humanity as a whole. So I'm gonna, welcome Ms. Suaad on the show. Thank you so much for joining me on this week's Public Health Talk series. I'm delighted to have you here.
Thank you for having me.
Thank you so much.
Thank you so much for having me.
You're very welcome. So now let's get right into it. So as we all know, I'm sure you're aware of the COVID-19 pandemic, around the world, right now. And there have been multiple reports that Gen Z have been acting irresponsible. Well, some Gen Z, let me rephrase that, some Gen Z and some millennials, they've been acting irresponsible about, taking the threat of COVID-19 seriously. So as a person that's, I guess, stuck in between Gen Z and millennial, I think that's where I see it, right? So what are your thoughts about this? And recently we've seen some people in that category, they've come out that the reports are not accurately true. So what would you say about that? So what are your thoughts about the responsibility of some Gen Zs and, some millennials, in terms of the threats of COVID-19?
Okay, thank you. Well, I would like to start with the fact that, thank you for not generalizing, because you corrected yourself and you said some of the, some youths, not everybody. I think when COVID-19, first of all, started, when the pandemic started, before it was officially tagged a pandemic, that people were not taking it seriously. They thought it was just in China. It's something that was so global, I mean, we haven't had something like this in centuries, if I'm right. So, but in recent times, I mean, it has claimed over like hundreds of lives. So people have changed, as a millennials have changed. They've changed the same thing. People know how serious it is now. Most countries are on lockdown. So everybody's paying attention to details, washing of hands and doing different things. So even if initially it did start that way, that people were not taking it seriously, especially we millennials. Am I a millennial? I'm not sure. Especially we. But things are much better now. Like, people are taking it so seriously, and I'm really, really glad. Like, awareness. I mean, something that could take lives, that's taking lives. You should really be so much into it, and it's being paid to think. We are thankful to those that are making that happen. So I think things are getting way better. People are staying home now. People are still going out. You can't exactly stop the whole world from moving around, but to a very large extent, people are staying safe, people are staying home, and hoping things will, get better from there. And yeah, things are getting better. Yes.
Yeah, I think it's actually a very valid point that you made, that
Yes.
It's unfair to generalize it, that we can't say all Gen Zs and all millennials are doing that. But I guess you can see the point where people are frustrated that, some of these people in that box that we just described, right? They're acting irresponsible at first, because for this group, we actually look up to them to help in raising awareness, about the threat of this disease. So this way, they can help educate, older generations and help stop the spread of the virus. So now, I mean, I assume you're home because there's really nothing to do. Everybody's home. And you're currently in Nigeria, right?
Yes, I am.
Yeah, so
Nigeria.
Yeah, so Nigeria is one of those countries that got their cases late when it comes to comparing to the other countries in the world, right? So, and even with that, thankfully, the cases are on the lower side, if I'm correct, right? Compared to the US or
compared to
other
like Italy and the US.
Europe, So what are we? I always personally, I always like, are we getting accurate data in Nigeria? Not that I'm questioning the government, right? But I mean, as a public health, professional, there's always, when you talk about data, right? You have to be careful, especially in this kind of situation, right? So we can only go by what we are seeing. So do you think that we're getting accurate, data? Because or what are the things that you're seeing on ground in terms of this, pandemic?
Yes. Honestly, when it comes to the data, like everyone is being skeptical, including me, honestly. And I wouldn't blame you for asking if we are getting the actual data. Because since the pandemic got to Nigeria, since the virus rather got to Nigeria, it's been, I mean, now we have over 200 cases, with about 33 being discharged and like 6 deaths. And it makes you question, okay, I mean, are we doing better than other countries in conquering it? Because it looks like everyone that goes in comes out like 2 days later and they're like, oh yeah, they've been discharged, like every day people get discharged. But this is good. It gives us hope that okay, things can actually get better. It doesn't have to be so terrible. But for the data being accurate, honestly, we can only hope so, because some states are claiming that cases. But how do you even know there's a case if you don't have the appropriate test kit? So technically, if you don't test for this virus,
I'm sorry. So do you
it
say they
remains
don't have the appropriate testing? Is that what you said?
the test kits to test if you're
Oh,
negative or positive for the virus.
yeah. So you're
Yes.
saying that,
So
are you saying that there aren't enough test kits in
yes,
Nigeria?
yes, I heard so that they are not enough. So it's like if you call them, they might not jump at testing you, because it's like they want to be sure you have it instead of wasting the test kit. And then contradicting this, I'm sorry, I don't want to call out anybody. There's a particular popular musician in Nigeria that tested 32 people and they all tested negative. So this is wasting 32 testing kits that you could use for other people. I mean, I'm not saying that you should not test people because we don't have enough, but all I'm saying is just be sure, be sure they've been
There is.
exposed, be
So
sure they have the symptoms.
basically, there is no like an effective strategies in place in terms of who gets
Yes, be sure,
infected.
yes, exactly. Be sure people have the symptoms before, be sure they've been exposed. Don't just test anybody that comes up with, oh yeah, I have a cough or I have an itch. But then I think, well, there's not enough testing kits.
Okay.
So if you're not testing people, how do you know we don't have more than 200 cases or more than 250 cases as we've been told? So it's just a gray area, honestly. I don't want to
It is a
contradict
great, and
myself
honestly,
saying test people
my take
or
on that is that I think we have more in Nigeria. It's probably more cases that is being reported because I believe that since it takes a while for the symptoms to actually start showing.
yes,
A lot of
about
people might
days.
actually have it, and they don't know it.
And
So
not know,
when
yes,
testings are not widely available, so it will be difficult for those kind of people to get tested. And from what you're
yes.
saying, if there are no, if we don't have effective strategies in place, then I'm sorry, then it just defeat the whole purpose.
What are we doing?
Exactly,
What
exactly.
are we doing? Exactly. And I'm so sure. I mean, I don't want to speculate, but I mean, I'm so sure so many people have this virus, but they haven't been tested. And they probably just self-medicating at home or waiting for it to get worse before they call for help.
Okay.
Well, let's just hope things do get better. And because of the lockdown, there's lockdown in about 3 states in Nigeria now. So because of the lockdown, it will reduce the number of people spreading it and other people getting exposed. So hopefully that should those that already have it to call out for help and not expose themselves to other people.
So
Yes.
in terms of how people have practice the preventive measures, so
Yes.
do you think people are following the policies in regards to this, or what are you seeing on ground?
The lockdown was put in place last Monday, but even before it was officially announced by the president, most companies were already working from home. Most people were already being they were already being responsible enough to start, to stop going out and start taking the preventive measures. But Lagos being Lagos, I saw on social media yesterday we're on lockdown and there was traffic on the island. So it's
So where are the
ridiculous. I
people
mean, it's
coming from?
funny. Exactly. We're supposed to be on lockdown, right? it's funny, but it's ridiculous that, I mean, this is a pandemic, for crying out loud. It's affecting the whole world. The least we can do is stay home. I mean, just stay. That's all we're asking of you. Stay home, for crying out loud. Don't let it spread more than it has already spread, because we are dealing with a lot. So the least you can do, how can you help? People want to help. So then you ask, oh, how can you help? And they're telling you, just stay home. That's all we need from you. And you can't even do that. It's really sad, So people just need to realize they should just stay home. Yes. It's that simple. There's no way to sugarcoat it or whatever. Just stay home. That's all we ask of you.
Yeah. So
Yes.
essentially, like, some people are still not practicing the stay home
yes, people are still not practicing it. Yes, there was a fitness instructor that was, like, he brought out like a massive crowd on the road, because the roads are free now because of the lockdown, and they were working out. I mean, you can work out through YouTube videos if you want to stay fit, or be productive, do something for your mental health, by exercising. But you don't have to expose other people to this just because you're being selfish. You can work out from home. You can take a stroll around your compound. You don't have to come out in numbers to work out on the road. But I think it's in charge of that now anyway.
Okay.
It's been put in
So
place now.
there's one thing I wanted to ask you again. So based on what we've talked about now, so what will be your message to the whole world? Basically.
Okay, you make me feel very important. I'm talking to the whole world.
Everyone is important. Everyone is important. Like,
I know.
Everyone has one or two things to contribute. So yeah. So like, you never know. Whatever message you have for the world might really stick with somebody else that will be watching this, later on. So yeah.
Definitely. Thank you. Well, it's already what we've all heard. It's what everyone is saying. Stay home, stay safe rather. Sorry, stay home, stay safe. Wash your hands. However way you can combat the virus, just do it. Clean, sanitize. Don't expose yourself. When you're sneezing, sneeze at the bend of your elbow. Things like that. And then for your mental health, because sometimes lockdown and being our mind plays games on us. It's like you can't go out. It's like you're chained. You there's nothing you can do, but there is something you can do, even if you're working from home or you're doing whatever at home. Maybe you're a student, you're back from school. You can keep yourself busy, keep your mind busy, read books, do things that distract you, things you would normally like to do that doesn't involve going out. Take a walk around the compound, call family, friends, make video calls. Video calls make you feel like you're closer. I mean, you're all the way in the US. We are having a conference. So, just do whatever you can do to grow your mind, so you won't feel captivated. You won't feel like you're being forced to do something you don't want to do. Just so that you're doing it for yourself and for the world. Is the least you can do, honestly. Just stay home for this period, and let's
absolutely.
keep
I couldn't
having
agree
faith
more,
and hope.
because I mean, in this time of distress, this is a better time to pay close attention to our physical needs and mental health needs. And I mean, and you've touched on some of these ways to actually, tune in. Read books, meditation is a great way, as well. So yeah. So, and I know this is it's kind of stressful on everybody, but with time, we're all gonna be out of this, when the time is right. So in the meantime, we just have to stick with all the rules in place, so that we'll help flatten the curve, So at Public Health Talks here, one of our goal here is to discuss different challenging public health issues affecting communities around the world. And I know, like I said earlier, when I was doing a brief introduction of you're big on mental health and human's, rights and all that. Yeah. So hopefully, I hope to bring you back on, other times to talk about some of this mental health or some of these public health challenges that you're seeing in your community, or the ones that you're, devoting your time to. So I think it will be great to actually see you like doing your thing in your elements, basically. So we'll be more than happy to have you back in another time to talk about, other public health issues that communities are finding challenging. So so thank you so much, for joining me on today's episode. And
thank you for having me.
I look forward to having you another time. Thank you.
I'll be glad to be back. Thank you so much. And well done. Thank you for all you do. Thank you so much.
Thank you. Thank you so much. Yeah.
Thank you.
Yeah.
Bye.
So that was Miss Suaad, Faruq Onikijipa that I just spoke with. Yeah. So I want to thank her so much again for joining me today on this week's episode. Yeah. So she's based in Nigeria, and I just get her perspective on what is happening on the ground on COVID-19 pandemic. So I hope you guys are staying safe and practicing the preventive measures in place. Until next time, you guys stay safe and stay positive. On the next video, I will be talking about childhood obesity and COVID-19 pandemic. Take care, guys. Bye-bye.